Congratulations for inviting me to talk. It's indeed a pleasure. And what I'm going to talk about today is the effects of the neurovascular system, the autonomic nervous system, on chemical sensitivity. Now, when we start looking at a person who has chemical sensitivity, we always look at the total body burden, total body pollutant load. And we also want to find out, how do pollutants enter the body, and how does the body sense it? And of course, we all know that there are many routes of sensing this, and of course the olfactory nerves, some come through the skin, respiratory areas, GI tract, GU tract in a lot of people, the eye, and of course the ear and hearing. And these intakes of pollutant sensitivity are what we usually look for. And there usually are three cardinal signs. One is itching, two is pain, and three can be other types of symptoms. Now, if we look at that, where do the pollutants go? And we have both central regulatory systems and peripheral regulatory systems. But if you want to look at the different areas of the brain, which is our nerve center, we have to look at the cerebellum, sorry, this should be cerebrum. That's an error there, diencephalon, midbrain, and hindbrain. Now, the superior cortex has the sensory and motor areas in there, and of course has emotions, consciousness, decision making. And the frontal lobe of the brain are the major areas, and of course the parietal lobe are sensories for sensory input. And I think this is extremely important. We have now done over 1,000 SPECT brain scans on patients, and have found that there are abnormalities in the areas of the cerebrum, in the areas of the temporal lobes and the parietal lobes where the sensory input is, and also in other areas which we will show in later discussions. What happened here? Computer glitch? All of a sudden we went dead. Good. I always screw up electrical apparatuses. Okay, temporal lobes, of course, the short-term memory and auditory, and most of the chemically sensitive people have short-term memory loss. Therefore, one has to take this into consideration, and you can see this well on SPECT brain scans. And of course, you have the occipital lobe for the sense of vision. Some of the chemically sensitive patients do have vision loss, or particularly have light sensitivity, and this area seems to be involved in some patients. And of course, the prefrontal cortex with the sense of smell, which I'll go into later, because many of the chemically sensitive people, the cardinal signs are odor sensitivity, and we can show that anatomically now and show it on the brain scans in addition to that. Now, the diencephalon, the thalamus, will show up on about 1 in 10 brain scans, and of course that's the for all sensory impulses except the olfactory, which is transmitted to the sensory areas of the cortex, and it of course relays impulses and from the cerebellum and sorry. Lost it. Again, I guess, how do I fix that? There we go. Okay. Somehow this is not going forward like it should. What have I done? Huh?
Okay.
Oh, okay. Now we go on. Well, anyway, one of the central areas in the brain that regulates the chemical sensitivity appears to be the hypothalamus. And of course, as you know, that the hypothalamus is a regulator of many of the functions on the body, in that It'll control water balance. We see a lot of water retention in a chemically sensitive patient. It can have sugar control and also fat metabolism and regulation in the rest of the body. So we have a lot of areas in which probably the hypothalamus is involved in the chemically sensitive people. And of course, many people have cold sensitivity, and most of these chemically sensitive patients run a temperature between 89 and 97 degrees, and usually are cold most of the time. Sleep cycles usually are disturbed, these patients. Appetite, we have both the people who waste away and the people who get quite obese, and the same with the sexual arousal in these substances. Now, the midbrain being a two-way conduction system also can be involved in this kind of problem. Now, let's look at the cerebellum, or the hindbrain, because a lot of the areas that one sees in there can cause problems in the chemically sensitive people. And of course, the medulla has cardiac, respiratory, vasomotor center control, regulation of breathing, swallowing, coughing, and sneezing. And the environmentally sensitive patient can exhibit problems with each one of these. You'll see people who have vasomotor instability. For example, they may have blue hands, blue feet, blue nose, red ears, red face. They may have difficulty in breathing, and that they get shortness of breath many times, and they may have problems with wheezing or cough frequently. The regulation and control of this breathing is partially in this area. Many people have difficulty swallowing. They'll describe food as catching here in the mid-esophagus or upper esophagus, and they have to wait for a while or drink water for the food to go down. You'll see, of course, sneezing in many people and vomiting in the people who are exposed, as Pilar showed in the cigarette guy. Now, the medulla will regulate the blood pressure, and it has some control over circulation. And so therefore, if the chemically sensitive and electrically sensitive patient does have problems with this, you know that some of these areas are then somewhat dysfunctional. And also, reticular formation is involved in these people. And we have people who sleep 24 hours a day. I see one of them in the room right now who used to do that. And it also can control the wakefulness. And a lot of chemically sensitive people have problems in which they get fogged all the time. They get brain fog, and they can't, they're like they're between sleep and awakeness, and they just don't function very well because of that, and they make sometimes inappropriate decisions of exposure, okay? Then, of course, there are many reflexes that one sees in the spinal nerves. Now, the other thing that we wanted to talk about just a little bit is the bulbo-circulatory facilitatory area, where there's excitatory activity, the reticular substance. There's transmit signals from the spinal cord to maintain tone and gravity of muscles and control the spinal reflexes. Now, let's look at the brain just a little bit more, in that there are excitatory areas and inhibitory areas. And I must say, if anybody has any doubts about this anatomy and physiology, if they will go to Netter's Anatomy, who's probably the most famous anatomical drawings, and Guyton's Physiology. Guyton was a neurosurgeon before he got polio and became paralyzed, and you'll find these are well accepted in standard medicine. The other thing that's quite interesting is that the excitatory area, predominantly in the brainstem, goes through the or above the fifth cranial nerve, and the inhibitory areas are down a little longer in the brainstem. So anatomically, there are areas that one can see there. Now, what are some of the triggers of excitatory and inhibitory reactions in the brainstem that cause chemical sensitivity in chronic degenerative disease? Well, of course, one is pain, and when you have the sensory input of pain in a patient, you have to immediately realize that the inhibitory or the stimulatory center is being triggered. And if that sensitive area is hypersensitive, people may have abnormal pain than the average person. And we do see this a lot with pollutant entry. And I, as a cardiovascular surgeon, have seen it at times where the patient has abnormal pain input and a hypersensitivity pain input that one can't really explain on ordinary areas of incisions and the like. And this is usually due to hypersensitivity and the chemical sensitivity problem. Of course, odor sensitivity is a prime one, and I suspect that if you polled the patients that are sitting back in the room with masks on, they would have hypersensitivity to odors. And of course, that goes directly in the brain, which I will show you later. Some people are light sensitive, and we see a lot of people with dark glasses, colored glasses, and even some of them have to have dark rooms. We see, I just had a patient, a physician from Jordan, a urologist, who came in, and you had to test him and treat him with all the lights out in a room. And you had to have the shades down because this massive sunlight would trigger off his whole sensitivity problem, then going into his neurovascular symptomatology, and he had interpreted that as electrically sensitive, and his TVs, computers, cell phones, and fluorescent lights would trigger the sensitivity. There are some people who are very sound sensitive, and they cannot, they plug their ears, and because of this super sensitivity that occurs. And then, of course, we have hundreds, thousands of patients who have food sensitivity and food additive sensitivity. And this occurs as a spreading phenomena occurs. And once you damage your neurological system, your vascular system, and your immune system, you will become more and more sensitive to more foods. And this can then propagate the problem. And if you don't deal with the food sensitivity, then you really strike out a lot of times on this. Of course, water and water additives, very few safe waters in the world today because they've been so contaminated. All wells in the state of Iowa, which is in the Midwest and in the breadbasket of the world, are contaminated with, for 200 to 300 feet with pesticides and herbicides. And of course, if most of the water comes from, if not wells, reservoirs, rivers, and lakes, which are now quite contaminated, the data is legion now. We've shown these in our books and many, many studies that have been done on this environment. And of course, air pollution will trigger this these areas in the brain, inhibitory and stimulatory areas. And so just breathing in Madrid today, we are taking X amount of pollutants in the air. I must say, I received a nice government brochure from the city of Dallas telling how safe our water was. And there were only 32 pollutants in there, which were all below the level of toxicity, and no pesticides because they didn't measure the pesticides. And of course, they didn't want to do that because that's the #1 offender in the world today and triggering of disease, in my opinion. And but we had dry cleaning fluid in our water. And do you think it's very good to dry clean your system? I guess some people think it is, but tetrachloroethylene and trichloroethane and ethylene are very toxic solvents which can dissolve the membranes of the vascular tree and nervous system and cause quite a bit of problems. So what people may say is safe and what is really safe are two different issues. If you compare the spring water with the other city waters, you'll find this gradients of toxics all over the world. And therefore, one has to take this into consideration as being a part of the total environmental load as well as the total body load. Now, the air pollution, of course, we know how good it is, and every city in the world over 20,000 has a pollution cap, and this pollution cap is what we breathe every day, and we have to select out O2 from that and see if we can survive. And of course, this can happen, as Peter pointed out, in the house very much too. Urinary contamination can also occur from our foods, as we said. Medication, I'm sorry, that's misspelled, is can cause problems. I've got a Spanish fly up here. And also, of course, our thought and our feedback channels are very important. Now, the autonomic nervous system, portions of it can be controlled by most visceral function, or they control it, and it's rapid. It's a rapid response. Like that, yeah. And you can increase heart rate in 3 to 5 seconds. You can faint in 4 to 5 seconds of exposure. Blood pressure doubles in 10 to 15 seconds, or drops in 10 to 15 seconds. And sweating, which is one of the cardinal signs of environmentally sensitive patients. The majority of them cannot sweat. They have very difficulty sweating, although there's a small group, about 5%, who are excessive sweaters. And we tend to, society likes to help those, but they don't like to help those that can't sweat. And this is a real problem, and that's the idea for the song. Their bladder will empty in seconds also. So you see people who have sudden urgency, they get exposed to a pollutant and they have to go right now, or they become incontinent. Now, so both the sympathetics and the parasympathetics then are innervated or originate, perhaps, as we say, in the brain with the hypothalamus, the brainstem, the spinal cord from T1 to L2, and sometimes the limbic cortex has to do with integrating this kind of system. So let's go to the sympathetic nervous system first, and that's all preganglionic fibers secrete acetylcholine. Now the other thing that's noteworthy, and I'll show this a little bit later anatomically, is that the area postrema of the brain is almost parallel in the brainstem to the area, the posterior or inferior vagal center. And of course, with this has to do with food. And some of the older anatomy books do not have the area postrema involved, but it's been described very well now. And so you can see why, with a spreading phenomena, one may get problems with the food handling area. So let's look at this and let's just see. Here are some of the areas in the brain stem, and right here are the cractus solitaris and the inferior posterior vagal center. And in addition to that, the area postrema is right here. And you can see the things we have described later on gets to very complex in the fourth ventricle and in the brainstem, in addition to the other areas of the brain. And I don't know what this is because this doesn't seem to be part of my slides, so we'll go on. Now we've had some areas, we had some misspelling. This is supposed to be the sympathetic nervous system coming out of the spinal cord, and one can see that very well. We know that the sympathetic nervous system is the stress system, the system that gives you acute stress response, able to respond. But if that system is chronically triggered, which pollutant injury does. For example, every time a pollutant comes in the body, you have a release of adrenaline, norepinephrine. And norepinephrine, apparently, because it wants to spasm the tissue in that area to wall off the pollutant, is there. So if you have chronic triggering of your neurovascular system, you will then have chronic stress. And what happens is people may get anxious, jittery when a pollutant enters, and then they will get fatigued. And you get chronic fatigue from this. And so you think about the multiple factors, total body load of pollutants that comes into an individual. If that keeps triggering your autonomic nervous system, then you have problems. And so this sympathetic nervous system is regionalized some, and you have the celiac ganglion and some of the different areas into the bladder, the hypogastric plexus, and so on. Let's go ahead and look at the parasympathetic nervous system. And of course, the nerves above 5 and below usually are parasympathetic. And then you have innervation to the whole intestine and the bladder and through the pudendal nerve and the hypogastric nerve. So this all fits with pollutant triggering. And one can see that one can have it imbalance the autonomic nervous system and then develop environmental sensitivity. And you know, probably most of the people in this room have some imbalance of it. And the thrust in medicine is that we treat it symptomatically because we don't look for causes. And our idea is look for causes and look for the nutritional deficiency so you can correct the physiology so it'll function better. So well, I thought we would choose the olfactory nerve since so many people have odor sensitivity. And the odor sensitivity is sensitivity to perfume, sensitivity to chlorine, sensitivity to car exhaust, gasoline, newsprint, papers, mold, foods, and so on. And so that once this occurs and your organ is sensitized, you will have disease process. So I put this out for Peter, but also from some of the other anatomists in there, that this olfactory nerve can be sensitized peripherally or even centrally. And it's interesting, if you look where this goes, there's one branch to the prefrontal cortex, and there's branches to the amygdala and the piriform lobe and several other areas in the body. So if this nerve becomes sensitized or overloaded, you'll have triggering in the body of these very problems. And if you want to look at it a little farther in here, you can see that the this area goes right here to the amygdaloid body. And what does that have to do in relation to the hypothalamus and the thalamus? Well, it can cause increase in blood pressure, decrease in blood pressure, increase in respiration, decrease in respiration, and GI function, and so on right down the line. So you will have this anatomically in the brain, and there is an interrelationship then between the thalamus and the hypothalamus, lentiform nucleus, caudate nucleus, and amygdaloid body. And so anatomically and physiologically, the chemical sensitivity and environmental sensitivity is well worked out now, and one can see what the problems are anatomically. We don't have to have bullet wounds or knife stabs or auto accidents into these areas for it to dysfunction, because what we can have is physiologic dysfunction and overloading of toxic chemicals, which are well known to show these problems. I thought I would get this just a little more there so you can see where these branches of the nerves go. And it can go to the thalamus and right down to the hypothalamus and trigger the autonomic nervous system. Okay, good. So where is the, usually the autonomic sympathetic nervous system in most of the body is only innervated by the sympathetics and not the parasympathetics. But the brain in the heart are the two big ones innervated by both the sympathetic and parasympathetic. This looks rather complex, and it is. But you can have damage in these areas going from the brain, going into the peripheral nerves, nerves going to the heart, and cause problems. So you got brain dysfunction, or you can have peripheral cardiovascular dysfunction, or you can have dysfunction into the bundle of His, which is the main conduction, into the atriums, which cause atrial fibrillation. Atrial fibrillation is one of the prime causes of chemically sensitive people who have cardiac involvement. And you have to remember that atrial fibrillation is the most common growing heart abnormality in the world today. It's absolutely skyrocketing, and we think this is due to the environmental triggers that go along with this. And of course, you have the intrinsic nerves in the heart muscle per se, which can cause cardiac death, sudden death, in about 29% of the patients, according to people in the American Heart Association. I'd like to show you this case because it's quite interesting. This guy was a mechanic. He was a helicopter mechanic. And so he worked around a lot of grease and a lot of oil and a lot of gasoline, fuel oil. And he had severe unrelenting headaches, and it was accompanied by tachycardias anywhere from 140 to 160, even perhaps higher, 200 at a time. He also had severe fatigue, muscle aches, fibromyalgia, and laboratory results showed that he had white blood count that was a little bit low. His venous oxygen for his oxygen extraction was quite high. In other words, he had blood crossing the membranes into his lungs that were normal, but they weren't extracting, and he was sort of like a hypoxic individual who just didn't extract his blood very well. He also showed a constant sympathetic response. And I don't know what's the rest of the, all of a sudden the rest of the talk has disappeared. But I will go on and give the results of this guy's treatment, because we did avoidance and we did neutralization of his hypersensitivity, and then we did different nutrient manipulations, and put him in sauna, and did massage and gave him immune boosters. And he's back to work now, still working at a toxic job, but being very careful, and having success, and has been there for years. I wanted to close with two other cases, which would be nice if you could define them, because these are quite staggering cases. One was a 70-year-old lady from Hawaii who had cardiomyopathy, and her cardiomyopathy was incapacitating, and she got to the place where she was non-functional, and everybody said that she was going to die, including all her physicians, and she had a ejection fraction of 20, which normal ejection fraction is usually 45 to 60, 70%, the ability to pump. She had a big heart that was sitting there. We found that she had zinc deficiency, and that she had selenium deficiency. In addition to that, she was loaded with several toxics. She was loaded with solvents, pesticides, and the like. And we put her on our treatment of massive avoidance and nutrition therapy and injections for the hypersensitivity stage, because if you don't treat for the hypersensitivity stage, you a lot of times will never succeed in this patient. No, that's the one I just gave. Try picking a couple more. So anyway, she started riding a bicycle. Now you have to remember, this is a lady who had a heart this big, filled her chest, ejection fractions were 20, that's dying, that's heart transplant range. That's one of the criteria we use for heart transplants. and she started riding the bicycle in a controlled environment after her injections and avoidance, and by the time she left the environmental health center without medication, she was free of her heart shrunk down and she could ride her bicycle an hour a day. And her 5-year follow-up in Hawaii, she walks down the beach for a mile every day as part of her therapy, getting fresh air. Okay. So that's the kind. Maybe if we find these, I can present them later. If I have time, I want to present one more case. And this was a 27-year-old state policeman, and state policemen change their cars. They have 3 shifts. So another policeman will ride in the car 8 hours, and then another one 8 hours, and then this guy would get it for 8 hours. Well, there are Christmas trees called glade in there. Ah, you got the microvascular, you got it up. Okay, good. Well, anyway, we would show them the microvascular circulation, which is somewhat independent of the heartbeat because of the gut and the brain and heart. So anyway, this trooper in his car found a substance called glade, which is a Christmas tree with air freshener in it. And he rode in that car for 15 minutes and became totally incapacitated and had a cardiac arrest. He was 27 years old. Unfortunately, he was resuscitated, and he had severe premature ventricular contractions. And they were refractory to all medications, the digitalis, the beta blockers, et cetera, the polypharmacy. And he was confined to a hospital room for weeks, and finally he was transferred to the Environmental Health Center at Dallas, and we worked him up and found, neutralized, decreased his total load, neutralized his pollutants, and with injections, and gave him intravenous nutrients, and then he cleared completely his arrhythmias, and his heart came back to normal functioning. And he did have to move to the seashore. He was from Georgia, and he moved there to get fresh air for a period of time. So what I wanted to show is the autonomic nervous system has many involvements, and it is coordinated with the sensory nervous system, and what you intake into your body, what the pollutant overload is, what the nutritional deficiency becomes, and that if you learn how to manipulate these things, you can get severe pollutant injury over, and you can teach people how to manipulate their total body load. So thank you very much. I'm sorry we got slides screwed up.